Choose a job you love, and you will never have to work a day in your life. This is true for many of us. When I seek for the answers to the following questions today about my dream, my hunger, my skills, my need, my identity, my satisfaction, I think I have scored fair enough in the above checklists. So, when I have joined here 15 years back, I wanted to tick in those checklists of my calling to heal, to preach, to teach, to research, and to serve. So, I remembered 15 years back when we joined here, new department, new instruments, new setup, new faces. First few months, many days we even left hospital premises around 10, 11 p.m. But we never felt the need to see the working hours, how many hours we have worked, challenges. We never used to feel tired. It was like Guns N' Roses songs, endless days and sleepless nights. Sleepless nights, not because of work stress or work culture. Sleepless nights because of our enthusiasm, our dream, our passion. So there is no substitute for hard work. This, I think, we all realized here. And you will never be bored if you have the job satisfaction. So I think for us, diagnosticians, every blood sample tells us a story. So this is true. So I end with the philosophical course of Albert Einstein. Life is like riding bicycle. To keep your balance, you must keep moving. So here in Kokilaben Hospital, our life is like riding bicycle. So one wheel is the wheel of work, dedication, hard work, patience, and another wheel is the wheel of patience, wheel of the clinicians, admin support. So this two wheel, when it balance, there is a balance between these two wheels, we have smooth ride in our work life, in our lab life.
I am Dr. Fazlas Kiamuddin from Sri Lanka, the Biochemistry, Immunology and Toxicology Laboratory. Central receiving area is assigned as a separate pool of staff. To avoid delays in transport, samples are received manually as well as through pneumatic tube delivery systems. To minimize the effects of pre-analytical errors, we utilize an efficient barcoding system and maintain strict transport conditions in our laboratory. The Department of Biochemistry and Immunology is equipped with 14 state-of-the-art instruments with backup facility. It covers a wide range of basic, specialized, and advanced methodologies to perform tests of general biochemistry, urine and other fluid chemistry, hormone profiles, cardiac biomarkers, hemoglobin A1C, blood gases, therapeutic drug monitoring, extended multiple myeloma panel, antenatal screening, autoimmune and neuroimmune profiles using indirect immunofluorescence analysis, line blotting, and monospecific ELISA for extractable nuclear antigens. As part of the quality control process, internal quality control samples are tested with each batch of specimens. Quality control results meet all statistical process control criteria before releasing patient results. We also participate in external quality assurance program with BioRed and College of American Pathologists, including accuracy-based assays and linearity verifications. The laboratory is accredited by national and international bodies like NABL and CAP. Indirect immunofluorescence assay needs expertise, practice, and knowledge. In our laboratory, indirect immunofluorescence assay covers ANA profiles, autoimmune liver panel, neuroimmune panels with neuroimmune markers related to autoimmune encephalitis and anti-neutrophil antibodies. This is indirect immunofluorescence assay for anti-nuclear antibodies. This is a pattern of homogeneous stained nucleoplasm with intensity of 4 plus. These antibodies are directed usually against double-stranded DNA and histones and found in systemic lupus erythematosus and drug-induced lupus.
And can you tell us about what AC number you will give?
AC1.
Hello. We are doing several neuroimmune markers in immunofluorescence microscopy, indirect immunofluorescence microscopy. So neuroimmune markers like NT-and-MDA receptor, autoimmune encephalitis, then VGKC, LGI1, Caspar-2, and many other paraneoplastic syndromes, along with the autoimmune markers like ANE, ANCA, dsDNA, AMA. So we do all those tests. So you must have seen the movie Brain on Fire, the New York Times bestseller. She wrote also, Susanna Kahlan, the cub reporter, who wrote The Brain on Fire, My Month of Madness. So she was a case of autoimmune encephalitis. And how does it look under microscope? If you see, so if you can see this, so we see this kind of pattern under the microscope where this is the case of positive NT-and-MDA receptor autoimmune encephalitis in CSF. So we do autoimmune testing and neuroimmune testing in our lab.
The laboratory is incorporated in Laboratory and Hospital Information System, and the test validation is done in the middleware. During technical validation, critical values are informed to the relevant clinician. The recent success in our laboratory is successfully incorporated automatic AKI alert delivery. Following technical validation, medical authorization is done by consultant chemical pathologist. This short description may highlight the actions which are taken by the clinical chemistry laboratory to minimize the errors and traveling through optimization of the precision and accuracy of the test results end up with better clinical outcome. Thank you.